Welcome. I'm Andrea Clessy for Woman's Hospital. Do you really know the difference between type 1 and type 2 diabetes? Dr. Karen Elkind-Hirsch puts you to the test.
So the thing to understand about type 1 diabetes is it is actually what we call an autoimmune disease. And that is one in which your own body actually turns on itself and attacks the body. And so what you see in most type 1 diabetes, you hear about that showing up in what we used to call childhood diabetes. So it would show up when kids were about school age. And the reason is that we found out that kids would go to school and they would get exposed to a virus. And we know that when you have a virus, your body revs up its immune system. And then, for whatever reason, which we don't understand, and we're trying to understand the genetics of it now, but that immune system actually turns on itself and destroys the cells of the pancreas that make insulin. So what happens is that these kids suddenly have absolutely no insulin available. Well, if you have no insulin, you have no way to metabolize your blood sugar. And interestingly enough, what you start getting is weight loss, extreme thirst, extreme urination. I mean, if it goes untreated, this is something you die from. But it's a very, very quick, kind of onset. It's a destruction of the cells, and so it can happen then. Another time we see it is at puberty, and occasionally we see it in older adults, but for some reason who've escaped it. Type 2 diabetes is totally a different phenomenon and a much more preventable one, and is also the one that we inherit. We don't inherit the type 1 diabetes. Everybody always thinks about diabetes being inherited. Is the type 2 that you inherit, because it's these genes that in some conditions are protective of the individual, and that is what we call insulin resistance. That's usually how type 2 starts. And what that is that the body becomes more resistant to its own insulin and makes your body have to make more insulin to metabolize your blood sugar. Okay, and so you're putting out a lot more insulin to normalize your blood sugar. And then what happens is that it becomes a vicious cycle. The cells that make the insulin get kind of worn out, is the best way to put it. So you can't make as much, and eventually you develop diabetes, because diabetes mellitus is simply just elevated sugar in your blood. So there's different ways you can get there. One is to not have any insulin, and one is that no matter how much insulin you put out, your body isn't responding very well. But it's the type 2 that we know that change in lifestyle, we can't change our genes, but we certainly can change the foods we eat, how much exercise we get. If you exercise simply 30 minutes, 40 minutes a day, you become more sensitive to your own insulin, because most of the way we metabolize sugar is through our skeletal muscles. So if you have larger muscle, bigger muscle mass, even resistance training, you're gonna be more sensitive. So getting that muscle mass increased will make you more sensitive to your own insulin. So that is the very big difference in the type 1 diabetes. The only treatment we have for that population right now is to take insulin. You have to replace what they don't make. In the type 2 diabetic, depending on where they are, we have things that make you more sensitive to your own insulin. We have drugs that make you secrete your insulin more effectively and efficiently, or we have drugs that make you make more insulin. So we have a cohort of different treatments that we use, single therapy, multiple therapies, all depending on how you present and what's going to be the most effective for you as a patient. So, the thing is, in the type 1 diabetic, it's pretty clear, because there is this weight loss, there's this extreme thirst, continual having to urinate. So you're always you're drinking a ton, you're peeing a ton. Now I know it's hard though, because you look at a hot summer and you have your kids outside running around, and a lot of times it is unfortunately not recognized, and kids and people have died. So one of the things is there is actually in the urine's actually sweet. I mean, that's one of the funny things, because in that disorder, you're actually excreting huge amounts of sugar into urine, which is why you have to urinate so frequently. and then you're thirsty in response to that because you're losing so much. So, you know, if that's something that's suspected, you can get a dipstick like for sugar in urine. So that's kind of a quick test for that one. But for type 2, you know, again, it's this very gradual increase in blood sugar that really doesn't really, in fact, most of these patients a lot of them are overweight. And in fact, insulin resistance makes it more difficult for you to lose weight. So if anything, in the patient who finds I have a really hard time losing weight, for women especially, it's gaining weight in the middle here, what I call there's always the pear apple shape that everybody hears about. But this is where men put weight on, but if a woman starts putting weight on here, that's usually a sign for insulin resistance as well. So it's that abdominal weight that's sort of an indication that they might be resistant, not necessarily type 2 diabetic, but they usually eventually go hand in hand. So inability sometimes to lose weight can have something to do. That might be a signal to you.
For more information, visit womans.org. Womans, exceptional care centered on you.